Oh. Check. Yeah, flick.
Yeah, see a report.
Oh, siyabonga. Buyile kaZulu. Senkani.
Ninjalo.
Good day, all colleagues. Welcome the Honorable Premier, the Province Premier Sihle Zikalala, who is joined today by the Honorable MEC for Transport, Community Safety and Liaison, MEC Nkonyeni, as well as Honorable MEC for Health, MEC Duran. We are going to commence with our media briefing today.
Thank you. Thanks, Mr. Mabaso. MEC for Transport, Community Safety and Liaison, Ms. Peggy Nkonyeni. MEC for Health, Ms. Nomagugu Smelane. Government officials who are present here, Mr. Mabaso and all government officials, the provincial commissioner of the SAPS in KwaZulu-Natal, distinguished guests, colleagues from the media, ladies and gentlemen, we extend our warmest greetings to members of the media and thank you for honoring our invitation to this media briefing. We meet here following the announcement a few days ago of a new and stricter measures that are aimed at containing the spread of COVID-19 through the shifting of our risk-adjusted strategy to alert level 4. Once again, we are called upon to summon our collective courage so that we can be remembered as part of the generations that successfully dealt with the threat of COVID-19 and saved scores of lives during one of the worst pandemics ever known to the mankind. We are here to unveil a new battle plan as the province of KwaZulu-Natal, where no fewer than 6 of our districts have been found to be the epicenter of the new and deadly Delta variant. Now is the time for us to unite, consolidate our effort, and recalibrate our battle plan as we go to war against this new variant and the lingering threat of a COVID-19 third wave infection. Maybe to start with, let's reflect on this new variant. As the province of KwaZulu-Natal, we have data that indicate that the Delta variant has been detected in 6 of our districts. These include Hirikwala, eThekwini, Zululand, King Cetshwayo, Ugu, and Uyilembe. We've developed our battle plan against this deadly variant. It all starts with acting fast and obeying all COVID-19 protocols and alert level 4 regulations. We welcome the scientific report that assures us that the vaccines that are being rolled out in our province, that is Pfizer and Johnson & Johnson, are more effective against the Delta virus when compared to previous variant. We are also told that the vaccines have an 89% efficacy when it comes to protection against severe symptoms of COVID-19. With regard to the COVID-19 status quo in KwaZulu-Natal, in the past 24 hours reporting cycle, the province registered 483 new COVID-19 cases, bringing the total number of reported cases to 352,401. The average number of cases recorded in the past 7 days was 753 cases per day. The province observed a 37% increase of cases in the past 2 weeks, which amount to 2,145. The actual number of new cases recorded was 3,159 for week 25 and 5,034 for week 26, which began, or which we will say it ended on yesterday. The increase in the number of new cases occurred in 10 of our 11 districts across the province, with the exception of Hirigwala district. So in essence, the increase is in all districts, and it's only Hirigwala where the infection rate is decreasing. The province currently has 10,532 active cases and has sadly registered 10,689 deaths due to this virus. May the soul of the dearly departed rest in peace. The number of recoveries currently stand at 330,316 people. We are observing that 5 districts are on resurgence, and those are eThekwini, uThukela, uMgungundlovu, Amajuba, and Umzinyathi. It is now a race against the third wave for us in this district. As part of our backup plan, we've consolidated in the following areas. Firstly, the COVID-19 staff capacity. We have employed on contractual basis about 15,000 staff members to help fight and increase our capacity to deal with the spread of this pandemic. And these posts include general professional nurses, specialty professional nurses, staff nurses, assistant or nurse assistant, administrative clerks, cleaners and porters, and including data captures. These brave warriors in this war have had to team up with our pre-existing cadres of healthcare workers and continue to mount a formidable fight to curb the spread of COVID-19. We're eternally grateful to all of them for the courage and determination that they have consistently shown. As we head for the stormy waters again, we call on them to remain strong, but without compromising their own health and safety. In the field of battle, even the sharpest shooter still has to wear a bulletproof and helmet. Therefore, we wish to remind all our healthcare workers of the importance of wearing their personal protective equipment correctly and at all times, and to avoid being part of large crowds, both within the work setting, in public, and at home. With regard to the bed status, we have reassessed our bed capacity to accommodate patients. The province currently has registered or we have secured 2,494 isolation beds as well as 1,411 quarantine beds that are dedicated for COVID-19. These beds will be repurposed and will then be utilized as and when the needs arises. All in all, our 4 field hospitals have a total number of more than 682 beds. Again, we will not hesitate to repurpose more beds if the need arises. We ask of everyone not to ignore the safety protocol. Even when it comes to the illicit trade of alcohol from the so-called Mr. Take It or Leave It, we ask of you to think twice, as through your actions you can cost life by overburdening the healthcare system. In terms of hospitalization due to COVID-19 as of now, as of the 28th of June, the province had 878 patients admitted in both public and private healthcare facilities. Of those admitted, 143 patients are in ICU, and that is 16% of those who are admitted, while 168 are on oxygen. The department has established bed monitoring centers in all districts, which monitor bed utilization and bed availability. To ensure accuracy of the statistics in this regard, all information is collated and updated on a daily basis. We will provide the breakdown of beds for isolation and quarantine per district and in all our districts. And as of the 28th of June, we can safely report that our bed capacity is as follows: 21,453 operational provincial beds. Then for isolation, 2,494. And for PUI, it is 1,411. High care, it is 98. ICU, it is 82. In terms of oxygen capacity, all our field hospitals, such as Ngwelezane, Justice Gizenga Mpanza, formerly known as Stenga, Claywood Hospital, as well as Pietermaritzburg Royal Showground, have been fully fitted with oxygen, consisting of 361 points. The upgrading of oxygen regulators have been completed at some of our regional hospitals, such as Edendale, RK Khan, Madadeni, and Prince Mshieni Memorial Hospital. Our system has been further boosted by the installation of a web-based oxygen cylinder management and ordering system. This enables us to ensure that oxygen is ordered timelessly and to avoid the shortages, which can be a matter of life and death in this regard. We are also in regular and direct contact with our contracted oxygen supplier, Afrox, to ensure that any threat to the supply of oxygen is identified and resolved early. We are confident that the oxygen capacity, oxygen management systems, as well as the contingency measures that were put in place to avoid shortage, will see us through these tough times. We must emphasize, though, that Although our capacity to implement an effective response is there, it can only be threatened by us lowering our guards and failing to play our part to curb the spread of COVID-19. It is vital that we protect our system so that they are not compromised through our negligence and then get overwhelmed. So we call on all people to follow the non-pharmaceutical measures that are in place. With regard to the vaccination, we continue to make significant progress with vaccination of both our senior citizens aged 60 and above, educators, as well as healthcare workers who could not be vaccinated during the first phase. As of the 28th of June, we had vaccinated 416,967 senior citizens, 68,748 educators, as well as 130,546 health workers. The total number of senior citizens who are currently registered on the electronic vaccination data system currently stands at 553,279, from a targeted number of just above 955,000. The number of vaccination sites that we have now prepared for Pfizer vaccine is 359, whereas for educators, we have prepared 102 vaccination sites. All in all, we currently have 152 active sites for both vaccines. In Umkhanyakude and eThekwini district, we have completed their allocated doses earlier than other districts. The vaccine doses will be available again from the 30th of June. The province is now vaccinating an average of 12,000 people per day. We are intensifying vaccination of the elderly and also increasing capacity in our rural areas. We urge all the qualifying categories of people at this stage to register on the database. Let us increase the registration tempo. If you have someone who is 60 years and above not vaccinated, please do something to assist that person. With regard to the plan to ensure enforcement and compliance with COVID-19 regulations, following the announcement of the adjusted lockdown to alert level 4, we have directed the Justice, Crime Prevention and Security Cluster to review its plans and come up with a clear program for the next 14 days and possible beyond. Already the Prof Joint, which is a structure that integrates all law enforcement agencies, has met to respond to the new developments. The new plan is informed by the experience and areas that previously have had challenges in terms of non-compliance with the regulations. In terms of this plan, the focus will be on residential areas where there is generally high movement of people, and we will have operations throughout the province. Already, work is taking place in areas that have been identified as hotspots, but we will now be beefing up the teams and our operations. Disturbingly, in the month of June, more than 1,763 people were arrested for violating the national lockdown regulation. A vast majority of those people were arrested for not wearing masks, as well as for cases of failure to confine themselves to their places of residence during the stipulated times. Among some of our plan for the heightened enforcement of the Alert Level 4 regulations are targeted enforcement operations in hotspot areas, intelligence-driven operations targeting illegal movement and sale of alcohol, multidisciplinary roadblocks targeting various crime categories, enforcement of the law to ensure adherence to regulated hours, enforcing compliance with regard to wearing of mask, enforcement of sanctions for other forms of non-compliance, and therefore overall patrolling of police. Whilst we commend the police for their work so far, we also implore them to prioritize their own safety as well. It is disturbing to know that some of our police members have also suffered through this pandemic. During the month of April, 10 police stations were closed due to COVID-19 infections, and in May, a total of 24 police stations had to be closed due to infections. The police stations were subsequently reopened after disinfection. The number of law enforcement officers infected by the virus in May was 23, and 14 officers have already recovered. We wish all of them, those who have not recovered, a speedy recovery. With regard to vaccination of police officers, we also wish to welcome the announcement by the President of the Republic of South Africa, His Excellency President Cyril Ramaphosa, that on the 5th of July, which is next Monday, we are starting with the vaccination of police and other security personnel. This is an important move that will protect fellow officers. MEC Nkonyeni, as the chairperson of the JCPS cluster, will lead this vaccination program. We are acutely aware of challenges of crime that our police have to deal with, and we wish to commend them on their good work, especially on dealing with crime situations in Pietermaritzburg. We know that some of criminals will want to exploit the plight of our people during Alert Level 4. We are sending a very stern warning that criminals must not dare try their luck with the police. We also appeal to the police to defend themselves against dangerous and merciless criminals. We are also concerned by the increasing number of gender-based violence and femicide cases in the province. The number of gender-based violence reported in May was 1,562, which is extremely concerning. The areas that were mostly affected by gender-based violence were Pheasants in Pietermaritzburg, Umlazi iNanda in eThekwini, eMpangeni eShowe, Madadeni, Phoenix, Chatsworth, Verulam, and KwaDukuza. We call upon those who are affected by gender-based violence to report it and not to confide in or to others, but it is important that these get reported for the attention of our law enforcement authorities, who must act without fear or favor. We have learned with great sadness about the passing away of our dear brother and comrade, Mr. Dan Mabuyakulu, who was a brother to former MEC, Mr. Mike Mabuyakulu. Comrade Dan was a former mayor of Amajuba, member of Newcastle Municipality, former provincial chairperson of SATU, former regional chairperson of Emalahleni of the ANC, and former National Chair of the National Council of TVETs. At the time of his demise, he was working in the office of the Premier, advancing the cause of farm workers and farm dwellers, in particular on issues relating to land reform. He will be dearly missed. We send our deepest condolences to his family and all colleagues who have been working with him. As we conclude, we continue to race against the onset of the third wave, and therefore we urge all fellow compatriots to play their part by behaving responsibly and avoid conduct that may lead into acquisition or the spread of the virus. We will be going corner by corner and district by district to vaccinate our people as more vaccine doses become available. To all health and healthcare workers who have once again risen to the challenge and continue to perform sterling job by saving lives every day, despite the risk of infection, siswele imilomo eyinkulungwane ukubonga. And we want to thank all healthcare workers. To those who have lost their loved ones, we send our deepest condolences. We say, lalani ngenxeba, akwehlanga lungihlanga. And to those whose loved ones are in hospitals fighting for their life, we are with you in our thoughts and prayers. Let us continue with the fight to stay alive. Now is not the time to give up. Working together, we can defeat COVID-19. I thank you.
Thank you very much, Honourable Premier. We are going to take questions. I'm going to start with the colleagues here, and the colleagues that are online will also give us an indication through my colleague Agiza and the colleague from the Office of the Premier. Can I see a show of hand here? Okay, ENCA. Yeah, number 2, number 3, number 4. In that order, please, and then we take it to the first one. March.
I'd like to find out where we stand in terms of meeting the 2-week target of vaccinating all educators and support staff. Not the understanding that there was in various districts a shortage of vaccines for educators. Has that issue been sorted, and how many vaccines were delivered for the teachers throughout the period?
Okay. Next colleague. Okay.
Fanele Mhlongo from SABC News. As government, are you worried about people who are camping at Kandla outside the home of the former president? As you understand that as we are on the alert level 4, the gatherings are not allowed, and their gathering is in violation of level 4 restrictions. And also the fact that their gathering might be one of the super spreader events.
KZN Namusha. I just want to double check the 15 health workers that have been appointed as to, are they appointed on a permanent basis or specifically for this for this period of the pandemic? Thank you.
Okay, thank you. We have one from Karinda. I think it's linked to the SABC one. What are KZN, is directed to the Premier. What are KZN government's plans to cap the gathering expected to happen outside former President Zuma's house in Nkandla? The second one is directed to the MEC for Health. What are the existing measures at our ports of entry, the harbour and airport? Are they enough to ensure new variants are not coming into the province? Are we ramping up security there? Those are the two that have on. This one is from East Coast Radio. Does the health MEC possibly have an update on Belverton Secondary School in Tongati, where 9 students tested positive for COVID-19 after attending a birthday party on Youth Day? Has the figure changed of more students who tested positive? Thank you.
No, thanks. I think I'll take few and then those who are responsible can add if MEC Nkonyeni and MEC Smilane Zulu will want to add. Let me take the question of people who are camping in any area. Right now, as government, we are guided by the approach we are applying on disaster management. And therefore, that is applicable to all areas in KwaZulu-Natal where there is a problem of people who converge as a crowd. We will need to attend to that through proper processes, and therefore that's what we can say, that the police have a responsibility to deal with that through ensuring that those who are gathered in a form of gathering, if it's a gathering, we are not allowing any gathering. Then let me opportunistically deal with the easiest one. Sheila, the 15,000 healthcare workers who are employed, they are on contractual pay, they are employed on contract, and we've been extending it, determined and dependent on the wave or the levels. But I must say that since we employed them from the outbreak of COVID-19, we've never terminated their contract. Thank you. You can come this side so that.
All right, thank you very much. I strongly believe that the Honourable Premier has actually responded to most of the questions that have been posed. But I just wish to indicate that we have decided to resuscitate our joint JOCS meeting, which are presided over by myself and the Provincial Commissioner, Lieutenant General Mkwanazi, whereby we have now adjusted our law enforcement plan for alert level 4, as that has been declared by His Excellency the President of the Republic of South Africa. We will definitely make sure that we secure the ports of entry. We will also conduct roadblocks and also conduct vehicle checkpoints to monitor adherence to the curfew, and also visit the taverns and all liquor outlets that are there. We will also disperse illegal gatherings, including public protests that are always happening, because our teams will be working in all 54 municipalities and in all wards in the province of KwaZulu-Natal. We will conduct inspections of businesses and construction sites, just to ensure that they also adhere to the level 4, alert level 4 regulations, and monitor the closing times for certain establishments, including restaurants. We will continue to conduct patrols and hotspots as they have been declared by the Honorable Premier, and of course, according to the social cluster report, there are hotspots that have been identified. We'll also monitor public facilities like your public pools, like your beaches, like your dams, lakes and rivers, to ensure that there are no people, who are entertaining themselves there. There are no public gatherings at all. So our plan is very clear. And as I have already indicated that the Provincial Joint Operations Center has been resuscitated, we will be meeting at 8 o'clock every Monday. We'll also be meeting on Wednesdays and on Fridays just to ensure that everything goes well in all districts and also receive reports. Thank you very much.
Thank you very much, Mr. Mabaso. Good afternoon to the Premier. Good afternoon to Ms. Nkonyeni, Siyabingelela Ndini. Good afternoon, ladies and gentlemen. I think Premier has responded to some of our issues, and that has covered them a little bit. But let me start with the issue of the educators on whether we now have enough vaccinations, and I think there were two questions. So I'll take them together. Firstly, when we started vaccinating educators on the 15th of May, it was always known that as the province of KwaZulu-Natal, we are only receiving 67,000 vaccines. And that was the plan that we had with the Department of Education. And even at that point, we had to agree with the Department of Education on how they are going to allocate them, who is going to be coming first, and when are they going to come. So it's not that at some point we ran out of vaccines and we were not aware. We were given an allocation of 67,000, and we were directed by the National Department that as soon as they have access to more vaccines, they will provide us with more vaccines. Fortunately or unfortunately, as the Department of Health in KwaZulu-Natal, because of the number of sites that we have, we are often quick to finish the allocations that we get. And in the past, when we had run out because of that, we would often go to national before the time that we were scheduled to be provided with new vaccines or a new allocation. And if national has, they would then provide us and would be able to proceed. Unfortunately, in this case, they were unable to provide us with more vaccines at the time because it was before our due date. And National did indicate that they will then provide us with more allocations on the 30th of June, which is today. And according to what we will be allocated, we will then be able to vaccinate the rest of the second batch. Let me not say the second batch, because even the amount of vaccines that we are going to get this time around is not going to be enough to cover the 127,000 teachers or so that are in the province of KwaZulu-Natal. We are going to be provided with about 50,000 vaccines, I believe, this time around, and that is then the educators that we are going to vaccinate until we get the second batch. So it has always been a plan that we get vaccines in batches, and we will vaccinate teachers in batches. It has been the plan that we provided to the Department of Education, and is the plan that was discussed and agreed upon between our joint management structures. So after we receive the vaccines today, we will then proceed probably from tomorrow or Thursday or Friday to start vaccinating the second batch of educators. And again, we will then have to stop and start again as and when we get the second batch. The next question was, what is our secret in terms of vaccinating the percentage of people that we have vaccinated? I must firstly indicate that in terms of the percentage, we are indeed above the national above all provinces in terms of vaccinating, but we are worried as a province because we think we are below the number or the target that we have set ourselves. And this is where we say to the people in townships and in rural areas that they must come forward. And I'm saying this because we want our people to hear this and understand that at this point, the only thing that is going to assist us, or the only thing that we have, is actually vaccines. And we are quite worried that old people in townships, old people in rural areas seem to be a bit reluctant when it comes to the vaccine. And that is due to a number of reasons. Some of them is the myths that are out there that continue to circulate amongst the elderly, even though we have tried to demystify or deal with those myths. So they are still there, they are still worried. We then have had to put in place a number of other strategies on how do we engage them in particular. So yes, in terms of the percentages, the province of KwaZulu-Natal, we are high, but we are not where we want to be. But your question was, why do we think we are able to get that number, or what is our secret? I'm unable to tell you what the secret is, except that right from the beginning when we started vaccinating, we created far much more vaccine sites than other provinces. When other provinces had started with about 3 or 4 vaccine sites or 1 vaccine site per district, we had started right from the beginning with 27 sites in the province. Firstly, because we understood the vastness of our province, but we also understood the fact that the majority of our people were people who come from the previously disadvantaged communities, and therefore half of them are poor and will not be able to travel very long distances. And we also implemented a strategy that was saying we don't just utilize our facilities as vaccinating sites, we also utilize community centers and community halls, which are closer to the communities, so that we are easily accessible. As a third strategy, we also have outreach teams that go to communities and are able to vaccinate communities in an environment or closer to where they live. But the last strategy is that those that are homebound or are bedridden, who are unable to come to us as the Department of Health, we have outreach teams that actually conduct home visits where we are requested to do so, so that we try and get everyone to be on the system as much as possible. So with all of those strategies that we are implementing, we think it is assisting us in getting the numbers that we are having, but of course we don't think it's enough. We are working on that, and we request that we work together with yourselves to disseminate the correct information to our people so that they are able to come and vaccinate. Are we still utilizing tracking and tracing? And apparently there seems to be a challenge with the technology on that part. Look, the technology that we were using as the Department of Health was always an add-on. It was never necessarily the main or the primary strategy of tracing and of tracking and tracing. The tracking and tracing that we are implementing in the province, first of all, says once you have your primary case or your index case, we must within 12 hours have contacted all the other contacts, or as many contacts as possible. So that is something that we do physically that does not rely on the technology. The technology is just there to assist us with picking up where there might be gaps, but it is meant to be an add-on. So our tracking and tracing process and system has always been in place, continues to be in place. We have targets and we have times that we say we must be able to trace those that have been infected, so that within that 12 hours we at least try to round up everyone that needs to be monitored, and we are able to do so. Sihle, I think your question has been responded to by the Premier. The 15,000 certainly are on contracts. We are hoping that we will be able to absorb them into the system, but that depends on the availability of funds, unfortunately, but it's something that we are actually working on. The last question was on 9 students that tested positive in Otongati. Well, we do have a challenge of clusters that we find in different schools and clusters that we find in different districts. The biggest contributors in the clusters of schools in particular are the district of Umgungundlovu and the district of Uthugela. Now, with the 9 students that have been highlighted, I think they do contribute to the clusters that we have in the province, and we are following up on those. And as I suppose as soon as we have the information and we have been able to trace everyone, we will then be able to provide the report if it's required of us. Mr. Mabaso, thank you.
Thank you very much, Honourable MC. Sheila, it's a final round.
No, mina owambuzo ngicela ukubuzisisa kahle lana ukuthi eGauteng sibonile ukuthi kube nesimo esinzima ngendlela emangalisayo ukuthi kuphele lento oxygen ney'ndawo nemvelo. So ngicela ngicacisele ukuthi ingabe singakubona lokwehlukile kunokwenzeka eGauteng nanalento yokuthi ayihead ukuthi kukhona u-Afros okuyena osuplya lento i-oxygen. Ngabe mhlambe yena kampani ekhona kuphela yini and yona ngabe iyanele na ukuthi ngakwazi ukubhekana nesimo sale Delta variant. Ngiyabonga.
Thanks. Bongani ngene KZN Music. Mesin ngicela ukwazi Premier ukuthi what's your message to the people of this province, especially with regards to the current situation of President Jacob Zuma? What would be your message? Siyazi ukuthi amaphapha phezulu kwabanye abantu and people instigating public gatherings, marches. So what would be your message regarding that?
It's not a question. Okay. Just a request. On Sina's question, can we have Lupinya also in this Zulu and then this is a statement.
Okay. All right. No, thank you very much. Let me then go to Sheila. Umbuzo wakho Sheila uthi singayibona yini sibhekene nesimo esicishe sifane nesimo esibhekene neGauteng currently. Ngiyacabanga nje ukuthi ngaphandle kokubuka inamba zama infections ezi-daily nathi ngesikhathi sika January sika December no January sasibhekene nesimo esicishe sifane. So lesimo esibhekene neGauteng isimo esingabhekana nanoma yipi province ngenxa yokuthi ivirus lena ayikho predictable. Isebenza ngendlela yokuthi awazi ukuthi at any given time ungayithola ivela kuphi ingaveli kusiphi kuyiphi indawo. Ngenzela ukuthi singabi neimpression yokuthi eGauteng kunento exceptional eyenzekayo. Of course uma ngabe kunabantu abazongawulaleli umgomo baqhubeke bahlangane baqhubeke baye emaphathini baqhubeke beye endaweni zobumnandi ebusuku, then uyithola unenkinga le iGauteng ebhekene nayo. Nathi njenge province yaKwaZulu-Natal ingakho uPremier egcizelela ukuthi labo bantu labo sonke njengoba sihlele emakhaya asiwagqoke phela ama mask, asizigeze izandla, sizisanitize, kodwa kubaluleke kakhulu asihlale emakhaya si-maintain social distancing. Siyazi ukuthi zikhona ezinye indawo zokujabula ezingawulandela umgomo okutholakala ukuthi abantu ebezingawulandela umgomo kutholakala ukuthi abantu bayafika khona bafike babe inamba engaphezulu ka50 before president esikhuphula ku level 4, but bebefika babe ngaphezulu kwenamba ewu50 befike bajabule bafike basondelane benze zonke lezo zinto, kodwa abanikazi beindawo lezobumnandi bengawulandela umthetho bengawulandela umgomo. Uma ngabe nathi kwi province yaKwaZulu-Natal kukhona indawo ezifana nalezo singayithola ama infections ethu ekhuphukile efike kuyona leyo number leyo. Engicabanga ukuthi siyavumelana sisonke ukuthi situation esingafisi sonke ukungena kuyona. Ngokwembhede nama oxygen ne-oxygen angiqale ngembhede. UNdunankulu uchazile la ukuthi imbhede esinayo ingaphezulu ka 2000 400 currently esithi imbhede yoku-isolator bese siba nembhede engaphezulu ka-1400 okuyimbhede sithi sibeka kuyona abantu abama patients under investigation okusho ukuthi bonke laba abathi nabefika esibhedlela beyisola ukuthi kungenzeka ukuthi bane COVID-19 noma befika esibhedlela bezokwenza okunye kodwa baba nama symptoms eCovid-19 sibabeka kuleyo mbhede sibateste and then before sibafaka emawadini abasuke kufuna baqonde kuona ngoba uma ngabe singakwenzi lokho kusho ukuthi singagcina infecta igule ikhona zonke esibhedlela kanti ikhona indlela yokuvimba lokho. So sinayo ke leyo mbhede siphinde sibe nembhede engaphezulu ka 680 esiyakhile ke thina ngama field hospitals. Ama field hospitals sizokhumbula ukuthi saswabalile ukuthi eClaywood sinamabili General Gizenga Mpanza sineyodwa eKing Cetshwayo sineyodwa esengwelezana esibhedlela sibe neyodwa ese-Royal Children's eMgungundlovu lawo esiwabalayo asemi permanent sithi semi permanent ngoba fixed esingawasusi siwabuyisele kuyenzeka ke ukuthi siphinde uma ngabe singakafiki ekutheni sidinge imbhede yakhona siwasebenzise for ezinye izinto. For instance yase-Royal Showgrounds khona manje siyayisebenzisela ukuvaccinate kodwa uma ngabe sesidinga imbhede yakhona ngoba ipetitioniwe kumanje the only thing you need to do ukuthi uthatha imbhede nje uyibuyisele ubusofaka istaff esizosebenza khona. So sinayo leyo mbhede leyo ke ready kodwa ngokusebenza kwembhede okwamanje sisasebenzisa imbhede ewu13% kuphela esibekele eceleni for COVID-19. Le mbhede esibalayo akuyona imbhede sithi imbhede sinayo yonke kwi-province ya KwaZulu-Natal. Akithi uma ngabe uneyibhedlela awukwazi ukusebenzisa yonke imbhede onayo eyibhedlela for COVID-19 bakho sisagula bakhona basaphathwa icancer bakusakhona baphathwa ushukela bakhona baphathwa izo zonke izigulo esihlale siba nazo. So yonke leminye imbhede esinayo siqhubeka sizama ukuthi siqhubeke nempilo as normal kodwa uma ngabe sesifika ekutheni lembhede u4000 esesibalile ayanele sizoba nayo isystem sinayo iplan yokuthi sizokwazi kanjani ukuthi siphinde ke sirepurpose ngamanye amagama sisebenzise eminye imbhede. Ukurepurpose kungenzeka kuzwakale njengokuthi sithi siqala phansi sakhumbhede cha. It literally means isiguli esikhona kuleyo mbhede noma igule ezikhona kulelo ward lelo uma ngabe zilala abantu iward lilala abantu abawu10 sikwazi ukuthi uma ziwu4 siyisuse siyitholele indawo but iward lonke silisebenzise for isolation and then we will continue to increase. So sinayo ke capacity yokukhulisa imbhede ibe mningi. Uyabona nje ke second wave sagcina sinembhede engaphezulu kuka 6000 ngoba sasenza kona lokho ukuze sikwazi ukuthi abantu mabefika begula sikwazi ukuthi sibahlenge kodwa ngoba kwamanje asifuni ukuthi sivele sivale wonke ama health services sifocus ku COVID-19 ngoba sikayidingi leyo mbhede sisabeke nje le esasiyakhele iCovid-19 kube yiyona esibhekana nayo but uma sesiba naso isidingo sokuthi inamba zethu ziyakhuphuka we will easily be able to add. That also includes ukuthi umbhede uhamba nabantu abakwaziyo ukuthi basebenze kuona udokotela unesi nabo bonke abantu esibadingayo who are health workers in that space. Abanye babo namhlanje sibafake kwezinye indawo bayasiza kwezinye ibhedlela bayasiza kuma sites kuba vaccine sites and all of that. So uma ngabe sesibadinga ke sidinga imbhede yakhona siyabarecalla sibabuyise sibafake kule mbhede abawudingayo. Cabanga ukuthi baba mabaso ngiqedile ngiyabonga.
Thank you. We want to sifisa ukumukela bonke abakhona sibonge ukubambisana ekutheni sikwazi ukudlulisa ulwazi ngesimo esibhekene naso esithinta iCovid-19 nangezinhlelo esinazo zokuqinisa ukuthi qinisekisa ukuphepha kwabo bonke abantu bakithi kulesi sifo. Ngiyafisa nje ukuthi siqale ngokugcizelela ukuthi njengoba iSouth Africa nayo isihlonzwe njengezwe elikhungethwe i-Delta variant neKwaZulu-Natal iaffectekile kakhulu kulesi simo ngoba ama district ethu ayisithupha sesihlonze sathola ukuthi anayo le variant lawa ama district afana no Herigwala, eThekwini, Zululand, King Cetshwayo, Ugu kanye neLembe. Siyaqinisekisa ukuthi lesi simo asiqhubekeli kwamanye ama district, kodwa into ezosilekelela kakhulu ukuthi abantu bakithi balandele yonke imigomo ebekwe uhulumeni. Le mgomo isho ukuthi masiqinisekise ukuthi siyazivikela ngokufaka izifonyo, sisanitize, siwashe izandla ngamanzi nensipho, sigcine social distance, and siqinisekise ukuthi ngisho siye emakhaya ama mask asiwakhiphi noma kanjani. Noma kunjalo siyafisa ukubonga ukuthi also science basinika isiqinisekiso esithi imigomo esetshenziswayo eSouth Africa iyakwazi ukudila nale Delta variant, ngoba bayasho bachaza ukuthi i-efficiency rate ekudileni nale variant iku-level ka-89%. Kafishane, ukusabalala kwegciwane le-coronavirus KwaZulu-Natal kuseyinto edlangile. Kulamasonto amabili izinga linyuke ngo-37%. Kanti uma singathi nje average esiyibekayo singasho ukuthi ama cases awu 753 ngosuku. Lokhu ke kusiphatha kabi ngoba okuye kuvele futhi ukuthi onke ama district esinawo ngaphandle kweHerigwala izibalo zabantu abatheleleka ngaleli gciwane ziyakhula. Ngesho elikhulu futhi sesiluze abantu abangaphezulu ka-10,000 abashiyile ngenxa yalesi sifo. Noma kunjalo siyabonga ukuthi rate yokurecover inkulu kakhulu ngoba abantu abangaphezulu ka-330,316 sebelulamile. Kodwa siyabona ukuthi ukudlanga kwalesi sifo, especially kulesi sikhathi esikuso, kubonakala kumawala eThekwini, othukela, umgungundlovu, amajuba emzinyathi. Siyafisa uqinisekisa ukuthi i-capacity esinayo ngokwestaff, abasebenzi bezempilo, ilingene ukuthi sikwazi ukudila nesimo esibhekene nayo. Ngokunjalo sinembhede eyanele ukuthatha bonke abagulayo abaphethwe ilesi sifo. Ngiyafisa ukuqinisekisa kumanje izinga le-occupancy kumbe lembhede available likhulu kakhulu ngoba lingaphezulu ka-80%. Kanti siyazi ukuthi njengamanje KwaZulu-Natal abantu abaseyibhedlela ngenxa yalesifo bawu-878, kuthi abantu abakuyi-ICU bawu-16% of that, okusho ukuthi bawu-143. Siyafisa-ke ukugcizelela ukuthi abantu abangathathi bayitshene ukuthi ukuyibhedlela kuyingozi. Cha, mabaye eyibhedlela nesikhathi, kungaze kube late umuntu afike sekunzima njengoba sabona kwenzeka nge-second wave. Izinga lokuba khona kwe-oxygen futhi eyibhedlela kuyo yonke KwaZulu-Natal liyagculisa, lisesimeni esikahle. Siyaqhubeka nohlelo lokuthi kugonywe bonke abantu abangaphezulu kweminyaka engama-60, ngokunjalo nalabo abasebenzi abafundisayo ezikoleni nabasebenzi bezempilo. Singaqinisekisa ukuthi labo abangaphezulu ka-60 years esebegomiwe bangu-416,967. Othisha abagonyiwe sebengaphezulu ka-86,748. Ngokunjalo abasebenzi bezempilo bayabonakala izinga linyuka kakhulu. Siyanxusa ukuthi abantwana nabo bonke abantu abakwazi ukusebenzisa ama-phones balekelele ukuthi barejiste abantu abadala abangakwazi ukuzibhalisa ngokwabo. Siyafuna ukugcizelela ukuthi njengoba umongameli ubaba uRamaphosa eshilo ukuthi njengamanje sesikwi-lockdown alert level 4, sizoqinisa kakhulu ukusebenza ekutheni wonke umuntu oKwaZulu-Natal alandele imigomo. Sibeke uhlelo oludidiyele olubandakanya ukuthi sizofocus ey'ndaweni ey'ngama-hotspot, okusho ukuthi la abantu bevame khona ukuthi behle benyuka bengalandeli umyalelo obekiwe. Sizobuye futhi sihole ulwazi lokuthi ngakube bakhona yini abenza izinto ey'ngafanele njengokudayisa utshwala nokunye. Koqiniswa futhi ama-roadblocks kuzo zonke iy'ndawo ukulwa nalo lonke uhlobo lobugebengu. Ngokunjalo ama-hour abekiwe sonke kumele siwalandele. Ngigcizelele futhi ukuthi masiqhubeke sifake izifonyo silandele yonke imigomo ebekiwe. Yilokho okuzosiza ukuthi sikwazi ukuzivikela. Ngiyafisa ukuvala ngokuthi sibonge ukuzinikela kwalabo abasebenzela amaphoyisa ngokunjalo nabahlengikazi, especially ezingeni lamaphoyisa. Siyabonga ukuthi ukuqina komthetho kuyabonakala nokusebenza komthetho kuyabonakala ey'ndaweni especially ezakhele iMaritzburg. Futhi siyafuna ukugcizelela ukuthi amaphoyisa kumele njalo aqikekele ukuthi ayazivikela ey'gebengwini nakuy'gilamkhuba. Kusiphatha kabi ukuthi udlame olubhekiswe kubantu besifazane nabantwana luyakhula kakhulu. Siyabona iy'ndawo ey'fana noPhesisleya, uMlazi, iNanda, eMpangeni, eShowe, eMadadeni, Phoenix, Chatsworth, Verulam nakwaDukuza ukuthi izinga lalolu dlame luphezulu kakhulu. Siyanxusa abantu ukuthi baqinisekise ukuthi bayabika emaphoyiseni bangathuli nalezi zimo ukuze amaphoyisa akwazi ukulandelela. Sifisa ukugcina ngokuthi sizwakalise amazwi okuzwelana nomndeni wakwaMabuyakhulu ngokudlula emhlabeni kababa uDan Mabuyakhulu ongumfowabo kababa former MEC uMike Mabuyakhulu. Baba uDan Mabuyakhulu waba yikhansela eNewcastle la ayesebenza khona kwi-Exco, wabuye waba umeya wamajuba district. Siyamazi futhi ukuthi nasemzabalazweni wenkululeko ubambe iqhaza elikhulu njengoba wakwaba ngusihlalo wesathu inyunyana yothisha KwaZulu-Natal, futhi waba ngusihlalo we-ANC eMalahleni region. Nakwi-state okusho ukuthi kuhulumeni siyazi ukuthi ube uchairperson, uke waba uchairperson we-National Council of TVET. Ngesikhathi kulesi sikhathi ke udlule emhlabeni sisebenza naye ofisini lakwa Premier kwaNdunankulu egxile kakhulu emkhakheni odila nezindaba zabantu abahlala emaplazini nabasebenzi basemaplazini, ebuye bheke kakhulu umsebenzi wokubuyiswa komhlaba ulethwe ebantwini. Siyabonga. Siyabonga. No, ngeke siubalekele lo mbuzo eniwubuzayo ngesinto. Sizwile and siyawuzwa lo mbuzo and ngiyafisa ukuphendula nje ngokuphelele. Okokuqala, i-judgment ephume izolo, i-judgment enama implications okusho ukuthi enezinto ezinemxhantela eminingi, futhi idinga ukubhekwa ama implications ukuthi izoba namaphi namiphi imphumela ebantwini nasembuthweni wenkululeko iANC. Yingakho ke ubuholi beANC kuzwelonke buthathe isinqumo sokuthi buzobonisana uma buhlangana ngaleli sonto kwi-National Executive Committee, bubonisana ukuthi ama-implications nemphumela yale judgment ithini kwi-ANC nasesizweni sonke. Ngiyabonga. Sifike kanjani? No, thanks. We have, of course, received and heard the reports of the judgment that was issued by the Concord. We are of a view that, yes, as the ANC leadership have alluded, there are implications of the judgment, but the ANC will discuss those implications and consequences in its National Executive Committee this coming weekend. Thank you.
And I feel that, colleagues, the message about the pandemic is the most important and critical one at this stage. Thank you. Thank you very much to all of you for attending. We adjourn at this point.